Hey guys, my name is Erin McCormick, and today for my lecture I'm going to be talking about stroke. So, an overview of the things that we're going to go over, the definition, different types of strokes, the anatomy and physiology, statistics involving strokes, the signs and symptoms, treatments, the different stroke assessments, and risk factors. Alright, so a stroke. This is a medical emergency that occurs when blood flow is interrupted by either blockage or rupture. Without blood flow, there will be no oxygen supply, there will be no nutrients, and there will be no removal of waste products in the brain. So this will cause brain cells to quickly begin to die. Different types of strokes. These are the three basic categories. Looking at the pictures, you can see you have the hemorrhagic, which is a rupture and leak of the blood. Then you have the ischemic stroke, that is a clot that stops blood supply. And also you can have a TIA, or what they call a mini stroke. We will go over these more individually in detail. Ischemic strokes are the ones caused by the clots. The underlying condition for this type of obstruction is the development of fatty deposits lining the vessel walls. This is called arteriosclerosis. The two types of ischemic strokes are cerebral thrombosis and cerebral embolism. And cerebral embolism is when the clot develops at the clogged part of the vessel. So this forms right in the vessel of the brain. The plaque buildup with these fatty deposits causing hardening or narrowing of the arteries. Cerebral embolism refers to the blood clot that forms at another location in the circulatory system, usually the heart or the large arteries of the upper chest and neck. Hey guys, this is Erin McCormick, and today for my lecture I'm going to be talking about stroke. So the overview of things we're going to go over, the definition, different types, anatomy and physiology, statistics, signs and symptoms, treatment, stroke assessments, and risk factors. So defining a stroke. This is a medical emergency that occurs when blood flow is interrupted by either a blockage or rupture. Without blood flow, there will be no oxygen supply, there will be no nutrients, and there will be no removal of waste products in the brain. This will cause brain cells to quickly begin to die. These are the three basic categories of strokes. So looking at the pictures, you can see you have the hemorrhagic, which is a rupture and leak of blood. Then you have the ischemic stroke, that is a clot that stops blood supply. You can also have a TIA, or what we also call a mini stroke. And we will go over these more individually in detail. With the ischemic strokes, these are the ones caused by the clots. The underlying condition for this type of obstruction is the development of fatty deposits lining the vessel walls. This is called arteriosclerosis. The two types of ischemic strokes are cerebral thrombosis and cerebral embolism. Cerebral thrombosis is when the clot develops at the clogged part of the vessel. So this forms right in the vessel of the brain. The plaque buildup with these fatty deposits causes hardening and narrowing of the arteries. With cerebral embolism, this refers to the blood clot that forms at another location in the circulatory system, usually the heart or large arteries of the upper chest and neck. So a portion of the blood clot breaks loose, enters the bloodstream, and travels through the brain's blood vessels until it reaches a vessel too small to let it pass. A second important cause of embolism is AFib. It creates a condition where clots can form in the heart, dislodge, and travel to the brain. In hemorrhagic strokes, these occur when blood vessels rupture and blood accumulates in the tissue around the rupture. This produces pressure on the brain and loss of blood to certain areas. The two types of hemorrhagic stroke are intracerebral, which affects vessels within the brain itself, and subarachnoid, which affects arteries at the brain surface, just below the protective arachnoid membrane. A TIA is like a stroke, producing similar symptoms, but usually lasting only a few minutes and causing no permanent damage. It has the same origins as that of an ischemic stroke. A clot blocks the blood supply to part of the brain, except this blockage is brief and only lasts a few minutes. The symptoms will disappear within an hour. Now we're going to watch a short video to see what all I'm talking about here. So just a couple seconds here while I get this video up and running.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. In contrast, during a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, in an intracerebral hemorrhagic stroke, a blood vessel bursts, spilling blood directly onto your brain, while robbing the intended tissue of nourishment. Both the hemorrhage and ischemia destroy brain tissue. A subarachnoid hemorrhagic stroke occurs when a weak spot in a blood vessel wall, called an aneurysm, bursts and leaks blood into the tight space between your brain and your skull. The high-pressure bleeding results in serious damage to brain tissue. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke. In the case of hemorrhagic stroke, emergency surgery may be necessary to repair damaged arteries or reduce the pressure of the blood on your brain. You may be given medication to help the brain's blood flow return to normal.
Okay, so sometimes it's just easier to understand what I'm talking about when you can actually see a video of what's going on with it. Alright, so here on this slide I have put up some facts and statistics about strokes. I was actually pretty stunned by these, with strokes being the 5th leading cause of death for Americans and the #1 leading cause of serious long-term disability. They broke it down to that someone in the U.S. has a stroke every 40 seconds, and with that, every 4 minutes someone dies of a stroke. I thought that was pretty crazy. And also interesting, the CDC's calculating that 40% of strokes occur in males and 60% in females. They've also broke down the statistics for different races. They found that African Americans have nearly twice the risk for first ever stroke than Caucasians. And lastly, I found this little map that shows the rates of strokes geographically. So you can kind of see where it's more populated, where there's a higher rate of stroke. There are some risk factors that stroke that can be changed, like age. The chance of having a stroke approximately doubles for each decade of life after age 55. While stroke is common among the elderly, a lot of people under 65 also have strokes. Another risk factor that can't really be helped or changed is family history. A stroke could be hereditary. Your stroke risk may be greater if a parent, grandparent, sister, or brother has had a stroke. And how we discussed earlier, race is another risk factor, with African Americans having much higher risk of death from a stroke. And then also on that last slide, we talked about gender. Each year, women have more strokes than men. And the last risk factor that can't be changed is if you've had a prior stroke, TIA, or heart attack. A person who has had one of these is a much higher risk than someone who has not. And the TIAs are what they call a warning stroke. So it's a good indication that that person is at way higher risk of suffering from a stroke. And continuing with the risk factors, there are some risk factors that can be changed, treated, or controlled, like high blood pressure. This is the leading cause of stroke, so it's important for people to get it treated or control it with diet and exercise. A second factor is cigarette smoking. Studies have shown that nicotine and carbon monoxide in cigarette smoke damages the cardiovascular system in many ways. Also, the combination of smoking and the use of oral contraceptives greatly increase the risk. Diabetes is an independent risk factor for stroke. AFib, like stated in the earlier slide, with this heart rhythm disorder, a clot can form in the heart, dislodge, and travel to the brain. People with high cholesterol have increased risk. And lastly, poor diet, physical inactivity, and obesity lead to the things above and contribute to a higher risk of a stroke. During a stroke, every minute counts, so knowing the signs and symptoms can prepare you to take quick action. If you have a patient who is complaining of sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, you should be thinking stroke. Next, you should try to gauge if that patient is having trouble speaking or is confused. Ask if they're having trouble seeing in one or both eyes. Do they have an unsteady gait or trouble walking? Are they dizzy or have a sudden headache with no known cause? And remember, if a patient says they have had some of these signs and symptoms and they went away after a few minutes, this is what they call a TIA, so still be quick to have action and care with these patients. So one acronym to use when educating patients or the public about stroke is the FAST, FAST. F is the face. Ask the person to smile. Does one side of the face droop? The arms. Ask the person to raise both arms. Does one arm drift downward? And speech. Ask the person to repeat a simple phrase and notice if their speech is slurred. time. If you observe any of these signs, immediately call 911. There are a number of different stroke scales used in both pre-hospital and hospital settings. Two of the more commonly used are the Cincinnati and the LA. The Cincinnati scale evaluates facial palsy, arm weakness, and speech. These three things are scored as either normal or abnormal. If any one of these three signs are abnormal, the probability of a stroke is 72%. With the LA stroke scale, you test those three findings in the Cincinnati scale, as well as blood glucose, the patient's age, if they have ever had a seizure, and the length of time symptoms have been present. So the main drawback of using the LA scale is that it may take slightly longer to complete than the Cincinnati scale. All right, now with treatments for stroke, it depends on whether it's ischemic or hemorrhagic. With ischemic, the stroke is caused by a blood clot, so you may be given a clot dissolving or clot busting medication. It's called tissue plasminogen activator, or TPA. A doctor will inject TPA into a vein in your arm, and this medication must be given within 4 hours of onset. If for some reason you can't have TPA, your doctor may give you an antiplatelet medication that helps stop platelets from clumping together to form blood clots. You could also get an anticoagulant medication that keeps existing blood clots from getting larger, and aspirin is a pretty common one. Medical procedures that are used to treat strokes are carotid endarterectomy and carotid artery angioplasty. Both procedures open blocked carotid arteries. When treating a hemorrhagic stroke, the first steps are to find the cause of bleeding in the brain and control it. Surgery also may be needed to treat hemorrhagic strokes. These types of surgeries used include aneurysm clipping, coil embolization, and arteriovenous malformation repair. Lastly, I just have a couple more videos I found interesting about real-life stroke stories. So let me get those pulled up for you guys.
Even with full access to healthcare, Canadians can have experiences that are less than ideal. When one Ontario woman believed she had a stroke, the doctors didn't. She recorded herself when she felt the symptoms coming on again, and she's sharing it with the world. CBC's Cass Russo reports.
It was a night much like this one. Stacey Jeffus was at home watching TV when it happened.
The whole left side of my body went very numb and tingly. And in my head, it's like, this is a stroke. And I'm like, I can't be having a stroke.
So she went to her local hospital for help. Doctors said it wasn't a stroke.
They had said that it was stress related and, told me to learn how to manage my stress.
When it happened again in her car a few days later, the 48-year-old did something incredible.
So now I'm taking the picture for an example of what happens.
Using her smartphone, she taped her own symptoms.
It's all tingling on the left side.
You have the wherewithal to turn a camera on.
Yep.
What possessed you to do that? Why?
Because I just needed somebody to see what was happening. When I'm telling people this has happened and they're saying it's stress, I'm like, I know this is not stress.
Her video was eventually shown to doctors at Toronto Western Hospital.
It's a small area that you see here. That's the area of injury.
And Stacey's self-diagnosis was confirmed. She had a mini stroke, 3 of them in fact.
Things that we typically think of as associated with older age, like high blood pressure, diabetes, high cholesterol, is happening more and more often in younger people. So young patients can present with stroke. Relief that finally somebody believed that it was not stress.
My tongue feels very numb.
Stacey's now at home recovering, and that video she took, her local hospital has asked for it to have a look at it and learn from it. Cass Russo, CBC News.
All right. And one more. little short video here. Okay, I think we just have to get through a ad.
And just making her comfortable. One night, Berta told me about a tradition in Denmark. When a person dies, she said, someone must open the window so the soul can depart. I smiled and squeezed her hand. Not tonight, Berta. Not tonight. To nurses everywhere. Thank you. From Johnson & Johnson.
Okay, here we go.
Staggering numbers are learning tonight. When a loved one suffering a stroke, they lose nearly 2 million brain cells every minute. This is why the cell phone video in this next story helps save a life. Nick Schifrin tonight, teaming up with our Dallas station, WFAA.
What? So you're not even speaking as loud as you normally speak.
Through his phone's camera, Dave O'Neill knew something was wrong.
Was the right side of your face numb this morning?
His fiancée Diane's face had gone numb, but she refused to go to the hospital. But Dave kept pushing and kept filming.
You do know and admit that I have tried to force you to give the hospital empty.
By the end, she could barely speak.
Give it time.
Turns out Diane was just beginning a massive stroke. Dave finally got her into the ER and showed doctors that video. It proved crucial and came in the nick of time.
It gave us a clear understanding of when the stroke started. And since brain attacks is a time-sensitive disease and every minute 1.9 million brain cells are dying, it is crucial for us to know when this started.
And because they knew, they could use a brand new treatment that pulls the dangerous blood clot out of the brain.
So this is the device right here.
It's the same technique used by Dr. Joanna Fifi.
If we know exactly when it began, we can skip the MRI and go straight in and try to take the clot out.
And use this device.
Yes. Today, Dave and Diane celebrate. She came close to paralysis, even death, but she's made a full recovery.
I think I'm a miracle patient. I think I am the luckiest person in the world.
Dave O'Neill told me today that you can't even tell anything happened to his fiancée, and David, that would not be the case. Had he not taken that video and gotten her into the hospital when he did.
She calls herself the miracle patient. We're glad for Diane tonight. Thanks, Nick. Great.
All right.